Our special coverage of the vaccine arrival continues here on One News Now. I'm Riza Diaz. 600,000 Sinovac doses donated by the Chinese government have arrived in the country. This is the Philippines' first batch of COVID-19 vaccines and is expected to kick off the country's mass inoculation drive. President Duterte personally joined the turnover ceremony this afternoon, and to give us the highlights from this afternoon's program, we have Camille Samonte on the line. Camille?
Yes, Liza, President Rodrigo Duterte, together with Chinese Ambassador Roque welcomed the arrival of the Sinovac vaccine. This is the very first vaccine supply that has arrived in the Philippines. Aircraft officials have started unloading the crate of vaccines, and all of these are being sanitized to make sure that it's free from any virus. These vaccines are now being loaded in the container van and will be transported in a DOH facility in Marikina. Now, in the turnover ceremony, Chinese Ambassador Roque says vaccine donation shows the solidarity between Manila and Beijing to boost military ties. President Duterte also expressed his gratitude. He says the delivery of the vaccine is a testament of the good bilateral partnership of the Philippines and China as we fight the global pandemic. The President also intends to visit China toward the end of the year to personally thank President Xi Jinping for the COVID-19 vaccine donation. Duterte says comprehensive global recovery hinges on the availability of life-saving vaccines. He also thanked Vaccine Czar Secretary Carlito Galvez Jr. and the Chinese ambassador for making sure of the timely delivery of the vaccine. Duterte also urged those who will be vaccinated to still practice the minimum health protocols. The country will start the national vaccination against the COVID-19 tomorrow with Sinovac vaccines donated by China. Now, this just came in as Secretary Galvez Jr. also mentioned just now that the delivery of AstraZeneca vaccine is cancelled for tomorrow. According to him, there was a problem with the supply and with the COVAX facility in transporting these vaccines to the Philippines. When asked when can we expect the arrival of AstraZeneca, Secretary Galvez says we just have to wait. Lisa?
Thank you, Camille. That was Camille Samonte reporting from Pasay City. Following the offloading and turnover of Sinovac vaccines at the Villamor Air Base, the vials are now on their way to the Health Department's storage facility in Marikina City. Bringing us more details is Gary De Leon joining us over the phone. Gary, how are the preparations there?
Isa ilang oras bago dumating sa Metro Park Cold Storage Facility ang Sinovac vaccine, nag-last inspection pa si Marikina Mayor Marcy Isidoro para siguraduhin na ready ang lahat ng detalye at protocol sa pagtanggap ng 600,000 doses ng bakuna. Naglagay na rin ang command center, ambulansya, fire truck at mga pulis ang LGU ng Marikina sa labas ng cold storage facilities. Wala namang report o banta ng mga tao magpoprotesta sa lugar, pero hindi pa sisiguro ang Marikina LGU. Kaya pansamantalang isinara ang mga daan malapit sa Metrovac, kaya walang motorista o residente ng Marikina na makakalapit ngayon sa Metrovac cold storage facilities. Dumating na rin ng Meralco para masiguro hindi magkakaroon ng power interruption sa cold storage facility, pero may backup power generator naman ang planta kaya hindi magiging problema ito. Habang nakaready na rin ang mga reefer van ng mga ospital na kukuha ng vaccine sa cold storage facility para sa kanilang rollout bukas, nagpadala rin ng tauhan ang Philippine Marine habang mahigpit naman ang sinasabang pagbabantay ng mga gwardiya ng cold storage facility. Riza.
Maraming salamat. That was Gary De Leon reporting from Marikina City. And this just in, Vaccine Czar Carlito Galvez and the Health Department confirmed that the expected arrival of the 500,000 doses of the AstraZeneca vaccine will not push through tomorrow. Health Secretary Francisco Duque said delivery of AstraZeneca shots will be delayed by around a week due to global supply problems. We'll try to get more information about this over the next hours. Meanwhile, the palace confirms that President Rodrigo Duterte will not be among the first to be vaccinated against COVID-19. This is according to presidential spokesperson Roque. In an interview here on One News, Roque said that Duterte has yet to be given the go signal from his doctor about receiving the Sinovac COVID-19 vaccine.
He will not be amongst the first. He is waiting for his doctor's go signal, and so he will not be amongst the first tomorrow.
Roque, meanwhile, assured that the first batch of vaccines will be more than enough to start the vaccination program in the country. This amid concerns about the limited supply of jabs so far.
That's it so far. And that's more than enough to start our vaccination program, because we would have enough basically for around 550,000 individuals already, because we're talking of 2 jobs, and there's about 1 million plus already coming, 1.1 million plus. So that's good for about 500,000 healthcare workers.
The first batch of COVID-19 vaccine has finally been turned over to the country. So let's get more insights about this. We have infectious disease specialist and DOST Executive Director Dr. Jaime Montoya. Sir, good evening.
Good evening.
Doc, what were your initial thoughts on the arrival of the vaccines and the ceremony that just concluded?
Well, it's a sigh of relief and excitement because now we are here at the verge of starting the campaign against COVID-19. We are truly very hopeful that this will be the start of the vaccine campaign that will lead us to achieving what we hope to happen, which is herd immunity, so that our populations will be protected from the virus.
Doc, what do you expect of the vaccine rollout, which is set to start tomorrow?
Well, I'm very hopeful that most of our healthcare workers, particularly the Philippine General Hospital and the other hospitals, will be willing to be vaccinated. This is a singular opportunity for everyone to be vaccinated at the soonest so that they will achieve some degree of immunity and prevent the occurrence of severe disease, at least if they get infected with the virus.
Dr. Montoya, do you think the arrival of the vaccines, together with, of course, the top officials willing to be inoculated tomorrow, could help change the mindset of those that are unwilling to get vaccinated?
Well, there's a particular segment of our population that would like our government leaders to set the example for people who are still undecided to be vaccinated. So I think the particular group of people that will actually work. Although some of the people are already set to be vaccinated, they have the desire to be vaccinated. The others, they have this attitude of not being the first to be vaccinated and still have a wait and see attitude. So it depends on what segment of the population we're talking about. But I do believe that seeing our leaders and some of our government officials be vaccinated would help set a good example to our people, especially those who are undecided to be vaccinated.
Sir, we'd like to get your insights. What can you say about the concerns of healthcare workers regarding Sinovac's efficacy?
Well, the vaccine efficacy is just based on one trial in Brazil. So they looked at the vaccine efficacy, the prevention of mild disease is at 50.4%. But of course, if you look at the prevention of severe disease, it's higher. It's at about 78%. So there's still a benefit in being given the vaccine. And remember, the WHO has already mentioned time and again that a 50% efficacy will be sufficient. Now, having said that, and with the recommendation of the FDA, we do bear in mind that if, for example, the healthcare workers who actually take care of COVID cases do decide to be vaccinated, then I think they should still be given the option and the possible benefit, because most of these people will be vaccinated, especially the initial batch, will of course be followed up and monitored as far as their antibody response is concerned. So I'm very hopeful that they would still be given some degree of protection.
So, Doc, do you expect that plenty of healthcare workers will be willing to be vaccinated already at this point?
Well, I think there's some excitement maybe you can say some are curious, but I think most of the healthcare workers are just waiting to see what will happen. And for as long as everything goes on smoothly, people stream and come and get vaccinated, I think that will start the process. It's really, I think it will be a bandwagon effect.
Thank you for your time, Dr. Jaime Montoya. Meanwhile, the Health Department recorded 2,113 new COVID-19 infections today. This is the fourth consecutive day that new cases breached the 2,000 mark. This brings the country's total caseload to more than 576,000, nearly 30,000 of which are active cases. DOH reports 29 patients died of the disease over the past 24 hours, while more than 9,000 have recovered from the infection. Now, across the globe, total COVID-19 infection approaches 114 million, some 2.5 million of which died of the disease. This is according to the Johns Hopkins University. President Duterte is currently holding a press briefing following the turnover of Sinovac shots from China. Let's listen in.
This is because wala nang mag-contaminate sa iyo.
So, sir, with the arrival of the vaccine, sir, when do we expect to achieve this herd immunity, sir?
Look, ganito ha. Mahirap kasi yan, ma'am. Because ang herd immunity, para sa akin, personally, mas maganda kung contiguous ang territory. Because you only have to do a circle, paliit ng paliit, paliit ng paliit hanggang towards the center of gravity. Ito island for island eh. And we cannot stop travel. And we cannot expect all people to agree to be vaccinated. That is the problem. Pero kaya nga, we have to take into account the freedom of an individual of what happens to his body. Nobody can tinker with his the human life. Kung hindi siya, kung ayaw niya, that makes it doubly hard for us. But that is also one which we have to take into account in dealing with the problem of COVID-19.
Sir, as far as our targets are concerned, do you see this happening within the year or next year or in the next 2 or 3 years?
Herd immunity, akin lang yan. Basa-basa ko lang. Wala akong, I have no reference except that I cannot recall now how many articles I've read about herd immunity. Ang Pilipinas, towards the end of mga early next year pa. Early next year.
Early next year.
If you ask a doctor, he would give you the same answer. Maybe. Maybe not. I'm wrong. Pero sabi ko, yun lang nabasa ko. What I've read from international magazine. Wala talaga akong, I must confess my incomplete and inadequate knowledge dito sa bagay na to.
On another and a similar matter, sir, now that we have started the rollout of vaccines, would you reconsider the IATF recommendation to place the Philippines under MGCQ?
Will you reconsider daw po yung placing Metro Manila under MGCQ now that we have rolled out the vaccination program?
I am considering it. Actually, pag-start, buksan ko na because there are two things that are really bugging us. It's the economy and COVID-19. Nakatutok yan. Our economy is really down, as in down. So, the earlier na mabilisan itong vaccine, the better. Ako, Pag nag-umpisa na yan, roll out, and the other vaccines would come in and distributed to the provinces, I may, siguro pagdating ng mga, we'll have 1 million by this month. Magkaroon na tayo ng stock ng 2 million, bitawan ko na. I will open the economy. Talagang hirap tayo. You know, people have to eat. People have to work. People have to pay for their upkeep. And the only way to do it is to open the economy and for businesses to regrow. Without that, patay talaga. So, mahirapan tayo.
Sir, when you say reopen the economy, that means placing Metro Manila under MGCQ in March?
As a matter of fact, kung kita ko na marami ng vaccine, open ko na lahat. Tanggalin ko na yan. Kung mayroon ng, if the vaccine is available to anybody for one reason or another, sa mga probinsya na distribute na yan, kasi hindi naman mag-abot ng 110 million. Sa estimate nila, it's about 40 million. Kung makahit tayo ng 40 million, o nandyan na yung vaccine, baski meron tayong mga 20, 30, buksan ko na. Buksan ko na dahil sa economy.
Sir, what about face-to-face classes po?
The what?
Face-to-face classes.
Wag muna. Not now. It would be, I cannot make that decision. It will place the children in jeopardy. Alam mo, iba na yung decision, iba na yung maraming mamatay. I am not ready to lose the lives of our young people, our children. Diba? Tingnan mo, as they come, pag tingnan ko nakabakuna araw-araw, what's the use? Yung mga ayaw, yung gusto pa ng ibang klaseng, there's the AstraZeneca. If you do not have faith in the Chinese, ako mismo, I guarantee to you, basa, yung 50%, nobody can really tell you how effective it is or the efficacy is at that number. It would depend on your body. If you are a healthy person with no underlying causes of diseases, talagang kailangan mo ng mas marami. Mahina ang katawan mo. Pero pag bigay mo yan kagaya sa inyo, yung mga babae, nagkayo nakatindig dyan, wala, that's 100, almost 90. Walang makasabi niyang there's no scientific data of comparison there. Wala pa. The fact that Malaysia, Indonesia, Brazil, Africa, UAE, I think, okay, the outcome has been quite successful. Sa China, wala na. Ginamit nila Sinovac, Sinopharm. Okay na sila. As a matter of fact, President Xi Jinping announced, basa ko lang, that China has overcome poverty. Wala nang pobre sa China ngayon.
Okay, ang susunod po magtatanong ay si Ms. Tricia Terada ng CNN Philippines.
Hi, good evening, Mr. President. Good to see you po. Sir, first question, how do you intend to address Filipinos who are still apprehensive to get vaccinated, more so with Chinese brands, for example, Sinovac?
Guarantee. I am giving the guarantee that it is effective. That efficacy is good. Ngayon, yung ayaw magpabakuna, wala akong magawa para sa inyo. Or you might want at least you know in your lifetime may kilala kang doktor. Magtanong ka na lang sa doktor kung anong mabuti sa iyo. Kagaya namin, 70 above are discouraged from getting it. Pero ako, since I get to go around and meet people to travel, baka kailangan ko. You ask yung guideline ng WHO, yung 70 above, wala na. Patay na yan. Eh ako 32 na next month.
Sir, experts are saying na mas mahihikayat po yung publiko na magpabakuna when they see leaders or influencers getting vaccinated. Sino po yung mga inatasan niyo, sir, na maunang magpabakuna, especially with the arrival of Sinovac? May naatasan po ba kayong mga cabinet members or officials in your government?
My doctor has in mind, it's a Chinese brand still, pero hindi ito. Siya nakaalam ng konstitusyon ng katawan ko eh.
Yes. Pero sir, may officials po ba kayo or cabinet members na aatasan na manguna po sa pagpapabakuna to represent the government?
Magsabay-sabay kami pagdating. Yung hinihintay lang natin yung ano.
Okay. Sir,
ako naghingi ako. Personal. Wala silang stock na ano. Naghingi ako para sa pamilya ko, pati sa akin. Pati yung, I don't know if we would have enough vaccines for everybody. But I think I can accommodate itong cabinet members.
Sir, I understand and you mentioned several times that you are grateful to the donations of China. Ito pong Sinovac, yung una po nilang pinadalang bakuna. But sir, how do you wish to address concerns about, or fears, sir, about the objective of vaccine diplomacy led by China and concerns, sir, on our possible position on different issues with China?
Again, ano daw po yung, tama ba ang tanong mo, no? Ano yung maging epekto sa iba pang mga issues na meron po tayo sa China dito sa pagdating po ng Sinovac vaccine?
Well, that's a matter of geopolitics. I have made a declaration that we will adopt an independent foreign policy, which means to say that, one, I assured China that I will not allow nuclear armaments of America to be stored in the Philippines. Yan ang sinabi ko. That's the guarantee that na hindi ako papayag, not because it will antagonize China, but it is in the Philippine Constitution which prohibits the presence of nuclear armaments in the country.
So sir, just to put it on the record and to be very clear about it, despite or amid this donations, we will not compromise anything on issues between China.
China never asked for anything. China has been giving us everything, but never asked anything from us, actually. Ang pinakamabigat, ang Amerikano, ang hinihingi nila, ang base. Alam mo ba kung anong mangyari? Do you know the direct consequence? Kung magkagera, and it will surely start, maybe in the theater of war would be the Spratly and China Sea. Katabi lang tayo, Pangasinan, it's just kaharap. Maraming probinsya na yan. Alam mo kung may armament sila dito, ang unang tatamaan yun. Saan? Sa Pilipinas. We are taking a very big gamble there. Kasi kung walang armament sa Pilipinas, yun lang kailangan natin sa counter-insurgency. Okay na, we do not need weapons that could fight other countries because we do not have it, the arms, and we do not want it. Ang unang matamaan, ang Pilipinas. Kasi nandito yung base, nandito yung mga armas nila. The arms are stored everywhere in the Philippines. Baka hindi ninyo alam. May mga depots all around the Philippines where the arms are. Sinabi ko sa kanila, I cannot stop you because we have yet to renegotiate the visiting forces agreement. But I'm warning you that if I get hold of a hard information that the nuclear armaments are here brought by you, I will immediately ask you to go out and I will terminate the visiting forces agreement. Ora mismo.
Sir, maybe one last question, not related to vaccine, since sir, matagal-tagal din po namin kayo hindi nakausap. Sir, there are growing calls for your daughter, Davao City Mayor Inday Sara, to run for president. Nabanggit niyo po na ayaw niyo po siyang patakbuhin. But is this final, sir, or is this still up for reconsideration, considering na marami pong gustong tumakbo yung anak po ninyo?
Pinal na ba ho yung advice nyo raw po na ayaw nyong patakbuhin si Inday Sara or pwede pa itong ma-reconsider sa dami po ng calls para tumakbo po si Inday Sara?
Si Sara ayaw because may anak kasi yung tatlo. Maliliit pa eh. Maliliit pa. Gusto niya na mag-focus muna siya sa family affairs. Sabi niya sa akin, marami pa naman panahon, and she used my favorite statement. Sabi niya, kung gusto ng Diyos maging presidente rin ako kagaya sa iyo, maging presidente ako. Hindi kailangan ngayon. She wants me, but if she does not want, if God does not want me to be president, I will not have that chance no more. Ganon rin. Alam mo, the presidency is a gift from God. Wala kang ano dyan. Ayaw niya ngayon. At sabi niya, kung ma-presidente siya, just assuming, after 6 years, bata pa siya, anong gawin niya? As an ex-president, hindi siya makatrabaho, hindi siya maka-appear ng korte, presidente ka na. At sabi ko, mabuti sana kung maganda yung sweldo, makapag-ipon ka. Pero wala ka naman ng ambisyon, diyan ka lang, trabaho, wala kang nothing to.
Thank you,
Absolutely.
sir. Salamat po, sir.
Ang susunod po magtatanong si Mela Lesmoras ng PTV4.
Hi, good evening po, sir. Ngayong may bakuna na, sir, sa Pilipinas at nalalapit na rin ang anniversary ng community quarantine sa bansa, paano niyo po i-assess o bibigyan ng grade ang ating government sa pagtugon sa COVID-19 pandemic?
Paano?
I-assess yung pagtugon ng gobyerno sa COVID-19 pandemic ng IATF at ating national government po.
Paano daw pong pag-assess sa response natin sa pandemic ngayong dumating na po ang mga bakuna? Paano po natin a-assess yung ating response sa COVID-19 ngayong nandito na po ang bakuna?
Oh, well, it would be, we must apply it as kung maubos ng isang araw yan, ituro ko yan isang araw. As fast as we can. But look, the Philippines is not Manila alone. Remember that. So may mga syudad, Lawag, Cebu, Davao, Cagayan, Dumaguete, Bacolod. Bigyan mo rin yan eh. Hindi basta-basta na ibigay mo lang lahat dito sa Maynila yan. It would not be fair. Yung lalo na kung may mga gusto, ibigay mo. Pero ratio and proportion. Mas maraming tao dito sa Metro Manila kaysa mga probinsya. Pero in the meantime, na wala pa tayong sufficient supply for everybody, ano yung damating ngayon at next week, paghati-hatian natin yan na ratio and proportion. Para naman sabihin ng the rest of the Philippines, nakakalimutan tayo. Tell Duterte that there are Filipinos over here, so many hundreds of miles away.
Sir, kung may nakikita po kayo, Mr. President, na dapat pang i-improve, saan po yun? Ano po yung ng grade, yung IATF, mga LGU, ano po yung ibibigay niyong grade sa COVID-19 response ng ating mga opisyal po?
It's either my ear is failing me, which actually is mahina andito ko kasi na I have a fractured at the back. May nagpuputo dito. Wala na ako dito, so I have to. Ito yung ear.
Mr. President, kung bibigyan po natin ng grade or grado yung ating IATF, yung mga LGU, sa COVID-19 response ng government, paano po natin sila i-assess at ano po yung mga nakikita pa nating pwedeng improvement ng government against COVID-19?
Well, that is, yung Department of Health is not a department alone. It is a structure all over the Philippines. So it behooves upon the municipal health officer, the city health officer, the provincial health officer, lahat sila must keep a record that is mandatory so that visitations can be made, especially those who are of age and vulnerable sa yung mahina ng katawan. I really do not know why they wanted to, or why they just exclude the mga 70 above, wag na. Pero ito yung mga vulnerable sa may underlying cause. There is anemia, maybe leukemia. Ito yung bukang ayaw na atang injection. Kung gano'n, ayaw mo injection, gusto mo mamatay na lang.
Sir, may last question po. Ngayong may bakuna na, kailan po natin nakikitang babalik sa normal ang Pilipinas?
In about maybe early mga year 2-3. Not the 2-2. Ito ngayon hanggang tatapusan ng buwan, paspasan tayo. Early, the first or second quarter of year 2023. Baka.
Thank you po, Mr. President.
Tulong ng Diyos.
Okay. Ang huling magtatanong po ay isang reporter ng Chinese TV, CCTV, si Miss Wang Zhengzheng or si Yellow.
Magandang gabi, President. Nice to see you again. My first question is, today the arrival of first batch of Chinese vaccine shows the Chinese government fulfilled its commitment. So what's your comment on this? Do you think that this vaccine can help the Philippines to recovery of the economy and bring our Filipinos people's life back to normal?
Yes. The vaccine that China donated could greatly help in the recovery of the economy. And it starts now, not really now, but maybe tomorrow, once we begin the rollout. And slowly, those persons who got the vaccines can go to work again and businesses will open. The reason why the businesses are closed is because there are no workers. Everybody is afraid to go out because of the absence of the vaccine. But with the help of China, and please convey my gratitude, xie to the Chinese government and people. It will greatly help and thereby promote a healthy trade and commerce with China.
Okay, President, I would also like to know, during your remarks, you mentioned that the vaccine should be made as the global public goods. That's also the commitment of Chinese President Xi Jinping. And China has already donated the vaccine to more than 50 countries worldwide. What's your comment on this issue?
I have to translate it.
Please repeat the question. I couldn't understand also the question. Slowly.
Okay. During President's remarks this afternoon, he mentioned that the vaccine needs to be made as global public goods. That's also the commitment of Chinese President Xi Jinping. Chinese government right now already donated the vaccine to more than 50 countries. So I would like to know the comments from the President.
Comments daw po ninyo dun sa sinabi ni President Xi na gusto niyang ibigay sa maraming mga lokal na mga iba pang mga bansa itong bakuna na galing sa China. Komento lang po dun sa sinasabi nilang they want to distribute the vaccine to as many other countries.
China has a good spirit. The people are kind, and the government is very not only just a great respect and love for mankind. Now, this will help along, ano yung tanong na?
Ano pa yung comment nyo lang doon sa sinabi daw po ni President Xi na they want to share the vaccine to as many countries?
Well, let me announce it again. China has donated vaccines everywhere for those countries who need help and do not have the money ready for the poor countries. China donated, but the protocol was you have to get the vaccine in China using your own transportation and bring it back, the medicine, to China. The Philippines, as of now, is the only country where China delivered using a military plane the vaccines to the Philippines. That is how good China is to us. Xie.
Thank you, Mr. President. And also, the last question, I would like to know, during your remarks, you said you would like to visit China soon and to take the message to President Xi Jinping personally. So I would like to know which city you would like to visit this time and what kind of message you will bring to President Xi.
Maybe I go to Xiamen. There's a school built to honor my mother. You know, my mother was one of the first educators of the Chinese school in Davao. I said, when you are, you have Chinese blood, you are the wife, you get, in 1950, we migrated to Davao, and my mother was able to get a job immediately. She was taken in by the Davao Chinese School. She was one of the earliest educators. So in China, they have built a building they named after my mother. So I'd like to go to Xiamen before going to Beijing. But what is important is that I told the ambassador, I would like to thank, and to travel to China even one day, just to tell President Xi Jinping, thank you. And I fly home. I want it to do personal because China has been good, and the way that's helping us right now, I suppose that a debt of gratitude should be paid by a personal visit.
Okay.
Thank you so much,
Maraming
President.
salamat. Maraming salamat, Mayor. Dito po nagtatapos ang ating press conference. Maraming salamat po sa mga kasama natin sa Malacanang Press Corps.
Ay,
At sa lahat
salamat.
po ng sumabaybay. Magandang gabi po sa inyong lahat. Dito po nagtatapos ang makasaysayang araw na ito kung kailan dumating ang kauna-unahang mga bakuna laban sa COVID-19. Dito po nagsisimula yung pagdating na liwanag sa panahon ng kadiliman. Magandang gabi po sa inyong lahat at maraming salamat po sa inyong lahat.
Salamat.
Madilim na kahapon, ikaw ang mag-aahon. Sa piling mo, di ko mawawala ang korupsyon. Tayo na, Pilipinas, tayo na magbago. Hawak kamay tayo para sa pag-asenso. Ikaw at ako, tayong lahat kay Rodrigo Duterte, para sa tunay na pagbabago. Masdan mo ang paligid, alamak mga krimen, rape, droga at mga nakawan, dapat nang mapigilan. Tayo na, Pilipinas, tayo na magbago. Hawak kamay tayo para sa pag-asenso. Ikaw at ako, tayong lahat kay Rodrigo Duterte, para sa tunay na pagbabago.
Why am I here? I am here because I love my country and I love the people of the Philippines.
Ikaw at ako, tayong lahat kay Rodrigo Duterte, para sa tunay na pagbabago. pamuno para sa pagbabago. Sawa na ang bayan ko sa magnanakaw na tao. Madilim na kahapon, ikaw ang mag-aahon